Are you ready to know more about EMDR, the breakthrough therapy for overcoming trauma and distressing life events? My name is Lisa Sager, and I'm a licensed professional counselor in St. Louis, Missouri. I'm also a certified EMDR therapist. I've seen remarkable results using EMDR with my clients. EMDR, eye movement desensitization and reprocessing, is an integrative psychotherapy approach that has been extensively researched and proven effective for the treatment of mental distress due to traumatic experience. It is an innovative clinical approach that has helped an estimated 2 million people of all ages relieve many types of psychological stress. Individuals who have survived trauma and neglect, including sexual abuse, domestic violence, combat, and crime, and those suffering from a number of other struggles including depression, addiction, anxiety, and a variety of self-esteem issues have found relief with EMDR. How was EMDR developed? In 1986, psychologist Dr. Francine Shapiro took a walk through the park, preoccupied with the distressing personal situation. As she walked, she noticed her eyes were spontaneously tracking from side to side. She also realized this was followed by a marked reduction in her level of distress. Shapiro decided to take these observations further, testing them out in clinical trials. Over time, she went on to develop the treatment known as EMDR. In the process, she discovered that it wasn't the eye movements themselves that were important, but the effect that the movements had upon the brain. This effect is known as bilateral stimulation, whereby each lobe of the brain is stimulated alternately in a rhythmic pattern. The result can be achieved by using eye movement, tapping the client's hands, or by auditory cues. Thus, EMDR can utilize different modalities to achieve the same effect in the brain. It is now common knowledge that the right and left hemispheres of our brain are responsible for completely different functions. To simplify, our left brain deals with logical, factual information, while our right brain performs all relational functions, including holistic thought, creativity, and intuition. Under normal circumstances, information flows freely between both parts of our brain. Under normal circumstances, we'll think about our experiences. We'll talk and express feelings about them. We'll dream about them. Over time, the emotional charge attached to some distressing experiences diminishes. We integrate each experience into our cognitive memory as part of our overall life experience until it has little or no negative impact on us in the here and now. We develop an adaptive understanding of these events. Unfortunately, when someone is very upset, their brain cannot process information as it ordinarily does. One moment becomes frozen in time, and remembering a trauma may feel as bad as going through it the first time because the images, sounds, smells, and feelings haven't changed. Such memories have a lasting negative effect that interferes with the way a person sees the world and the way they relate to other people. The theory behind EMDR is that it helps people reach an adaptive understanding of their memories by evoking similar brain patterns to REM sleep, a time when we process information and consolidate memory. To understand more about this theory, let's look at recent neuroimaging studies with SPECT scans, which have pointed to the possibility that the brain actually stores traumatic memory in an entirely different way than non-traumatic memory. According to the studies, when a person is remembering neutral, non-traumatic events in their lives, the frontal cortex lights up. The frontal cortex contains both frontal lobes and Broca's area. As we previously discussed, the frontal lobe's functions are rational and relational. The importance of Broca's area is in producing language. In contrast, when the same person remembered a traumatic event, the left frontal cortex shut down, including Broca's area, the speech center. But areas associated with emotional states and anatomic arousal lit up, particularly the areas around the amygdala, which can be called the smoke detector part of the brain. The experts conducting the studies have suggested that when people relive their traumatic experiences, the executive functions of the brain shut down. As a result, they have trouble thinking and speaking. They're no longer capable of communicating to themselves or to others precisely what's going on. They also believe that these studies showed that people process their trauma from the bottom up, body to mind, not top down. This may explain why regular talk therapy hasn't shown itself highly effective in the treatment of traumatic memory. Brain imaging studies performed to evaluate the effectiveness of EMDR with PTSD have revealed some remarkable results. These are SPECT scan images taken using a gamma camera. The left photo shows the brain activity of a woman with post-traumatic stress disorder. The red areas indicate overactivity in the brain. The right photo shows the same person after 4 90-minute EMDR sessions. Notice that the EMDR therapy produced a marked reduction in brain activity, which is indicative of a reduction in distress. Need more proof? Controlled studies of victims of Vietnam combat, rape, molestation, accident, catastrophic loss, and natural disaster indicate that the method is capable of a rapid desensitization of traumatic memories, including a change in thought processes and a significant reduction in client symptoms. But what if someone is suffering from depression or anxiety and cannot recall any specifically shocking event in their life? What does EMDR have to say about that? Not everyone can recall an outstanding, overwhelming situation. However, if we define trauma as a distressing event we're not prepared to handle, then it's likely that we can all remember times when we felt unprepared and overwhelmed. EMDR has proven to be effective when treating an accumulation of distressing life experiences as well. With over 60,000 clinicians trained worldwide, EMDR is one of the fastest growing methods of psychological treatment used by mental health professionals. The U.S. Department of Defense and Department of Veterans Affairs placed EMDR in the A category as strongly recommended for the treatment of trauma. Dusty Bowenkamp, RN and certified trauma responder for the American Red Cross, states, EMDR assists survivors in the immediate aftermath of violent trauma by breaking through the walls of denial, shock, grief, and anger. It is ideal for those who have been unable to forget past traumatic events, as it allows for rapid processing of even deeply rooted memories, giving individuals back control of their lives and their emotions. The bulletin for the miniature clinic states, EMDR is a significant component of treatment in the trauma recovery program at the miniature clinic. What are well-known psychotherapists and researchers saying about EMDR? Dr. Stephen Lazaroff, Yale University, states, EMDR is a powerful new tool for relieving human suffering. Its study opens new doors to our understanding of the mind. It's one of the most significant advances since the introduction of psychopharmacologic drugs. Dr. Arnold Lazarus, Rutgers University, says EMDR is one of the newest and most promising methods that has arisen in the last 10 to 20 years. EMDR attends to the client as a complex and multifaceted person. Laura S. Brown, Ph.D., University of Washington, says, EMDR quickly opens new windows on reality, allowing people to see solutions within themselves that they never knew were there. And it's a therapy where the client is very much in charge. which can be particularly meaningful when people are recovering from having their power taken away by abuse and violation. Dr. Herbert Fensterheim, Cornell University, states, EMDR is the most revolutionary, important method to emerge in psychotherapy in decades. A word of warning: all EMDR therapy is not alike. A quick search on the internet could produce a wide variety of self-proclaimed EMDR therapists. Unfortunately, the professional training of these individuals may be greatly lacking. Think about it. Do you want an inexperienced, haphazard novice as your chauffeur down a sometimes challenging memory lane? Or would you prefer a trained and licensed mental health professional? If you're interested in finding a mental health professional trained in authentic EMDR, your best bet is to contact the EMDR International Association, an organization Dr. Shapiro, the creator of EMDR, was instrumental in developing. EMDRIA is tasked with setting standards for training, providing ongoing professional education, and encouraging quality research. Thanks for your interest in EMDR therapy. If you'd like more information, you can visit my website, emdrstlouis.com, or the website of the EMDR International Association, emdria.org.